UK Prime Minister Boris Johnson has left Thomas Hospital after being discharged on Sunday. He will continue recovery from his country residence. On the advice of the medical professionals, he will not immediately return to work. He thanked staff at St. Thomas Hospital for excellent care he received. Meanwhile, a further 717 coronavirus patients died of coronavirus in the UK today, taking the nationwide total to 11,329. Anais Mutumba, a Rwandan based in the UK, is standing by and joining us from the UK. Thank you so much for joining us, Anais.
No problem. Thank you.
Now, give us the latest. How is the situation like? What was the response, first of all, towards Boris Johnson's recovery?
So I can't speak, but I know generally it's positive. Obviously we don't want Prime Minister to die. That's not great. And it's also, in a way, kind of shown him, even though it shouldn't have been this way.
I'll cut you short. Do you mind bringing your microphone closer to you? The microphone, the earpiece. Thank you.
Can you hear me better now?
Yes, I can. Fantastic. So tell us, what was the reaction in the UK on Prime Minister's recovery?
So generally speaking, it looks positive. So a lot of citizens are obviously happy because we don't want our Prime Minister to die. And what's come off the back of that, especially if you listen to his 5 minutes, when he's talking to the NHS staff, he's actually realizing just how much of the NHS is made up of immigrants and different members of society. So that's also been a bonus from the back of it.
So the numbers I mentioned up, there have been a bit of an increase in terms of death, but there was a reduction. Do you think there is a possibility, if you see around where you're staying, that UK is likely to reach a certain flat curve, and then what is the optimism like in terms of getting back to normal life?
I think it's a mixture. At the moment, obviously, Boris Johnson is not currently working, so we have our Foreign Secretary, Dominic Raab, and he's going to review the lockdown measures on Thursday, and I don't think he's going to lift them. Personally, I think the lockdown was implemented a little too late, and so that's kind of what we are experiencing at the moment. There's not enough PPE for the nurses and doctors on the front line. There's not enough testing, so we don't actually know quite how widespread it is and who has what. And whilst the majority of citizens are listening, we do have some that are obviously sunbathing because it's hot. So it's been quite hot the last few weeks. So some people have been out sunbathing and still having gatherings despite the measures that have been put in place. And also in terms of the Prime Minister and what he's thinking, he thinks that the lockdown is definitely going to go on for longer. So for now, we're not really sure of when the peak is coming and when it's going to reduce. So I think it's just a little bit of a guessing game at the moment, especially as we continue to see a rise in cases. And I mean, this morning alone, 4,342 tested positive as of 9 a.m. So that's quite a lot of people. And near where I live, the Nightingale Hospital in Manchester was set up, and that was built in just 14 days. So I think there's still, there is some optimism, but I think there is still an element of we're getting ready for the West.
Very quickly, before I move to the other question, is why do you think there is people are not actually paying attention to lockdown in the UK as it's supposed to be?
I think it's because even though it is serious, there hasn't been as many cases in terms of, some people have obviously experienced what's happened and they're the ones that are listening to the rules, but then some of us are far removed. So for example, where I'm based, there's only a handful of cases in my city. So it doesn't feel like anything is really happening. So you would believe that it's okay to go to the park and sunbathe because you're staying away from other people. Whereas obviously that's not the rule. The rule is you're allowed to go out once a day for exercise and to get some essentials. So I think people are just thinking, well, the sun is out. I'm not going near anybody else. And the people that I'm going next to, they're not sick. So it's fine. And I think that's why it's happening. There's some people that believe that it's okay because they're hanging around with people that they don't feel are sick. But the problem with that concept is that people can be carriers for up to 10 days. So how do you know they're not sick? So that's the issue that we're having as well. And with people not being tested, that makes it even harder to be certain.
And before I leave you, we cannot, of course, I cannot let you go without talking about Kwibuka in the UK. You're Rwandan, of course. So how did the commemoration go amidst this pandemic?
So there are different regions, obviously, in the United Kingdom. So where I'm based right now, there aren't as many Rwandans here. But I know in London, there was various Zoom calls. And for some of us in the Rwandan Youth UK community, of which I'm the deputy chairman, we watched the live broadcast. And we were also keeping in touch with what was going on. And then we had the minute of silence and we watched the president's address. So we were definitely all connected despite the fact that we couldn't actually attend in London like we usually do. And then we also had different speakers that would normally be at the Marylebone Church in London, release videos touching on the different things, including our ambassador in London as well. So it felt very different, but I'm glad that we still continued with the memorial and we still had the commemoration the way that we should. And then, for example, the Ishami Foundation as well have started to raise money to help families in Kigali who would probably feel even more worse off because the lockdown would mean they can't work. And they usually are the only breadwinner in their family. So that's been really great that we've been able to give back to the community from here in the UK.
Anais Mutumba, thank you so much indeed for joining us here on RwandaTV.
Thank you very much.
Stay safe.
Thank you.